Diabetes mellitus, unveiling the immunology connections. Diabetes is chronic disease due to prolonged unhealthy lifestyles. Diabetes is a crucial issue among countries in the world. In Malaysia itself, there are research found almost 3 million Malaysian citizens was identified with diabetes. Guys, did you know that immunology play a significant role in a diabetes mellitus? So, what is diabetes mellitus?
Hi everyone, my name is Erwin and today we'll be talking about understanding what is diabetes mellitus. So what is diabetes mellitus? Diabetes mellitus is actually a chronic metabolic disorder which is categorized by elevated levels of blood glucose or in layman's term blood sugar. This is due to the inefficient insulin production or ineffective utilization of insulin. So basically this can be caused by when the pancreas of the individual is not actually producing enough insulin to actually regulate the body's level of blood glucose. This can cause many complications. One of it is kidney failure and so on and so forth. So basically there is two types of diabetes and the two types are basically type 1 and type 2. Type 1 diabetes is basically an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin producing cells in the pancreas. So this type of diabetes is actually caused by cellular destruction where the immune system of the body is basically attacking the pancreatic cells which produces the insulin. Type 2 diabetes is basically where the body is a genetic factor. So basically this is particularly seen and can be caused due to factors by changing diets, sedentary lifestyle and increasing obesity rates. So basically this is caused by the individual itself and it is due to their lifestyle and how they proceed to take care of their body's health. Alright, next would be the prevalence. So type 1 diabetes is estimated to have around 1.6 million people worldwide that actually has type 1 diabetes, with the prevalence varying by region, and it is most commonly in developed countries. So basically type 1 diabetes is more relevant in more developed countries, as type 1 diabetes is usually by a cellular genetic thing and it is usually common with people in developed countries. And type 2 diabetes is basically seen in many undeveloped countries and developed countries alike, but usually more prevalent in undeveloped countries. Is basically it has a particularly alarming rise in prevalence due to changing of diets, sedentary lifestyle, and increasing obesity rates. In 2021, usually we can be seen that 463 million adults, which is aged 20 to 79, were living with type 2 diabetes globally, and this number is actually being projected and is actually on the rise in 2023 as well. So next will be the rise and consequences. So basically the rise of consequences is actually talking about the escalating prevalence of diabetes and whether it has a significant consequence to the individuals and society at large. The potential consequences include health complications, healthcare burden, reduced life expectancy and impact on family. So basically health complications can be seen as the uncontrolled diabetes can lead to actual various health issues such as heart disease, stroke, kidney failure, nerve damage, etc. etc. Healthcare burden is basically where diabetes imposes a substantial economic burden towards everyone, is because this healthcare system has to allocate a lot of costs with managing the disease and treating its complications. Furthermore, talking about the reduced life expectancy, basically we are talking about how diabetes can shorten one's life expectancy is due to the fact that it's quite a chronic illness, and it actually is quite a severe issue if it's not managed properly, especially when complications arise during that time. And lastly, it's talking about the impact on family. This is very true because diabetes not only affects the individuals but the families and those around them who provide support and care as well. So that is all from me. Thank you.
So imagine your body as a fortress. The immune system is its defense force, always on guard. From skin barriers to white blood cells patrolling within, it combats harmful invaders like viruses and bacteria. Some defenders remember past attackers, ensuring swift victories in future battles. But if this system malfunctions, it can sometimes mistakenly target our own cells or overreact to harmless substances. In essence, our immune system is a complex, dynamic protector always working to keep us healthy. So, diabetes mellitus, especially type 1, isn't just about sugar levels. Dive deeper, and there's an immune story. In type 1 diabetes, our body's immune system mistakenly identifies insulin producing cells in the pancreas as threats. Acting like overzealous guards, it attacks and destroys them. Without these cells, our body can't produce enough insulin, leading to a high blood sugar. So imagine a virus entering your body. Sometimes this invader carries proteins that look a lot like those in our pancreas, insulin producing cells. When our immune system defeats the virus, it might confuse these look-alike proteins in our pancreas for remnants of the enemy. In a case of mistaken identity, it attacks these vital cells. This misguided assault is called an autoimmune response. In some people, this leads to type 1 diabetes as our own defenses diminish our insulin production. It's a mysterious interplay between viruses and our body's defense gone awry.
So we now understand why type 1 diabetes mellitus occurs. But we don't know how. So let's unravel the mechanism of what actually happens once this inappropriate immune response and the antibodies actually do to the beta cells of the pancreas. But before that, let's look at how glucose is normally utilized. Glucose is taken into the beta cell by means of glucose transporters embedded on the membrane. They then undergo aerobic or anaerobic respiration to be converted into ATP, which is the energy currency for the human body. The generated ATP can then bind onto potassium channels, forcing them to close and preventing exit of potassium out of the cell. The increase of potassium in the cell also increases the positive charge and thus opens up voltage-gated calcium channels. As a result, calcium rushes into the cell and stimulates the release of insulin from these vesicles. There is also another enzyme called glutamic acid decarboxylase, which converts glutamic acid into a molecule called GABA, which is responsible for further insulin production as well as protective effects of the beta cell. Now the antibodies can affect the cell in three different areas: anti-islet cell antibodies, anti-GAD antibodies, and anti-insulin antibodies. Insulin triggers increased expression of glucose transporters on the cell membrane. The glucose can then leave the blood and enter the cells. But since the antibodies attack the beta cells, the amount of insulin decreases and thus less expression of glut molecules. As a result, there is increased blood glucose, and that is how type 1 diabetes develops.
Hi, my name is Disha. So I'll be talking about the early detection of diabetes. As we can see, the early detection of diabetes is actually very important, where we got to know the signs and symptoms such as increase in thirst, slow healing of cuts or sores. The process of the healing will take time. Usually the process occurs in actually 1 to 2 days. But then for people who are diagnosed with diabetes, they will have a longer period of healing. And then fatigue, frequent urination, especially at night time. So these are the normal symptoms where a diabetes patient will have. The main one is actually weight loss. So you will have a tremendous weight loss when you're having diabetes. And as we can see, so before the hyperglycemia, you can see that your oxidative stress and then triglyceride dysfunction and then mitochondrial dysfunction, all of this occurs before. So the stages where you have already diagnosed with diabetes, you'll be having inflammation, amyloid deposition, and also the B cell apoptosis. So these are the cases where diabetes 1 and also diabetes 2 patient might suffer from. So what are the ways where you can actually stop or also prevent from? So you should actually take more fibers and also reduce the saturated fat intake, because rice and also carbohydrates can actually lead to glucose level increase. So physical activity is also much recommended, as you can actually make yourself healthy and also engaged with a healthy lifestyle. So this can prevent your diabetes type 2 and also your management of stress and also weight loss. As we can see, the lifestyle change of diabetes patients are such as body weight, smoking, diet, and physical activity. So these are the main stages. Your body weight will tend to lose or also decrease in a very fast period as you are having this diabetes. And also, if you are a smoking patient, you will have a very high increase of glucose level, so your blood sugar will be very high in your body. And also your dietary must be very consistent, as this will play a main role in your diabetes healing procedure, as you are going treatment or taking medication, so your dietary is also very important. So, as I said earlier, physical activity is also much recommended, as the number of muscle in your body will actually deteriorate and also start to work when you are actually facing diabetes. So, all of these are the process where you can actually start off when you're having diabetes.
What should I do to avoid from diabetes mellitus? To prevent from it, we can practice healthy lifestyle, control our sugar intake in our daily life, eating healthy diet, and exercise to enhance our metabolism.